Welcome to the August edition of A Minute with the CEO. I'd like to start with our 2020 vision, and that is for all of our stakeholders to be the leading and preferred provider of acute and subacute services for South East Victoria. And by South East Victoria, we're looking to go right through to the New South Wales border. That vision will see us treating 36,000 inpatients per annum by that year, which effectively represents about 50% market share of all private patients emanating from Gippsland through Pakenham, Berwick and through our local area. That will require 550 beds, overnight beds, to accommodate that demand, and I think most of you are well aware we're on the way to establishing that number of beds. We have 60 more beds about to start construction at the Valley. The first 30 will be open around about February next year. We've also got more theatres in the pipeline as well, and we've got another 60 mental health beds at South East Private. At the moment, between I guess now and February, we're under increasing bed pressure, and I think you're all know and feeling the pressure of that. On 12th of August, we're bringing surgery across from South East Private, and that's going to intensify the bed pressure. To cope with that, we're going to cap Burnett to 20 medical beds and stream the medical patients between the Valley and South East, with only the acute patients being able to be accommodated at the Valley, at least until February when the new beds are open. So for the next 6 months, it's going to be pretty tight. Also, to assist that, we're developing a transit lounge to assist early discharge, and we are really trying to crack down on getting patients discharged on time, and by on time we mean by 10 o'clock in the morning. Certainly, late discharges will certainly attract our attention. To also assist this process, you'll be aware we've got our new hospital physicians, John and Warwick, have started, and their role is to really work and help the VMOs in direct admits, early discharges, met calls, avoiding met calls, and there's been a number of those avoided already, and generally just playing a support role to both our VMOs, our physicians and surgeons, when they're not in the hospital, to be on hand. They'll also play an increasing role at South East as the acuity of the medical patients increases.
Hi, I'm Warwick Dobson. I'm one of the new hospital physicians at the Valley and at South Eastern. I'm sharing this role at the moment with John Ding. We are both emergency physicians. My background, apart from emergency medicine, I do regular work in the intensive care unit, and my background in training, I was in advanced surgical training until I changed programs.
I've been involved with Valley Hospital since the new RCU started. I was working as a fellow in the unit. Patient review emergency cases as required by the ward staffs, and attend med calls, and review medical charts if there's any concern there, then liaise with the physician and the surgeons, and to help their patient care, basically.
You'll also have noticed that the mobile phone reception's improved enormously around the hospital. It costs us about $300,000 for works with Telstra, including coaxial cables, but now we've got good reception everywhere, so we're really pleased with that, and really pleased that now the VMOs are well connected to the outside world. For Vodafone and Optus users, we are negotiating with those two companies for them to connect into the portal that Telstra have provided, and we'll keep you posted on that. I'd also like to welcome my new Deputy CEO across the Valley and South East, Jim Giannopoulos. Jim comes a highly credentialed, very experienced operator, and I'm really pleased to have Jim on board.
Hi everyone, my name is Jim Giannopoulos, and I've recently joined the Valley as Deputy CEO under Neil's leadership. I'm really excited to be here, and it really is an exciting time for the Valley and South East Private. I've been in the healthcare game around 25 years and started off my journey at the Alfred for 10 years and then at Medtronic, a medical leading device company, for 15 years. I'm really delighted to be part of this exciting future, both the Valley and South East Private, and I look forward to meeting you personally and be part of this exciting vision for 2020 where we see the South East catchment area. Thank you.
I'm also very pleased to welcome aboard Andrew Blythe, our General Manager at South East Private. Andrew is a long-standing Healthe Care employee, and we're really pleased to have been able to provide Andrew with the opportunity at South Eastern, and I'm sure he'll fit in very, very well.
I'm the new General Manager of the South Eastern Private Hospital. I've been with the Healthe Care for the last 7 or 8 years. The bulk of that time has been as the national manager of one of the other Healthe Care businesses called Healthe Work, which is an allied health business in the field of workers' compensation and Transport Accident Commission, helping people get back to work and rehabilitation. And in that role I've managed businesses across Victoria, Canberra, New South Wales and Adelaide. I've only been here a few days so far, but I've been really impressed by the friendliness and the openness of the staff and the doctors, and I'm really looking forward to working with everybody to develop the South Eastern further.
That concludes A Minute with the CEO for August. Look forward to talking to you again in the next few weeks when we bring you more updates and developments around the Valley and South Eastern. Thank you.